All right, you're live.
Great. Hey guys, it's Dr. Emer. We're end of the day in West Hollywood, and we have a beautiful patient here today who I've known for a very long time. It's exciting because we're doing treatment for the first time. And one of the things I want to point out with age, with smoking, with environment, with sun, people start to get some wrinkles and some sagging around the mouth. And it tends to make them feel a lot older than they appear. And I want to show you here, if you take a look, she has some deeper lines here. And one of the things I tell people is you can't just fill a line and make a great outcome. It needs to be a combination of things. So one of the treatments we're going to do today is to use a little bit of filler to kind of give her some volume back into her lip to help those lines themselves. But the long-term plan would be to maybe even lift the lip or do laser procedures around there to resurface the skin. We need to improve the collagen in that area. So it's going to be a combination of things. But this is the starting point. The other thing is when she goes home, she's going to use Lucy & Co. Lip Plumper because that lip plumper is going to give her some pinkness to her lips, and it's going to keep this filler lasting there much longer. So it's going to be great. So our initial starting point is going to be, let's build out a little bit of volume to her lip. Okay, little pinch. And here's the hard part, you guys. Oh, she's doing so great. The hard part is we want to keep this a natural look, obviously. We need to give her some volume because she doesn't even have sort of the lining of her lips. So the most important part initially is going to be to create a little bit of the shape here. So see now, if you even take a look, just that alone, outlining of the lip, you see the border of her lip. It's already making a difference, you see? Because she doesn't really have that border clearly defined. So we're just trying it a little bit, at least for now, even though we know we're going to need more volume. This is a good starting point. And to do that, we need to create a little bit of the columns. We need to create a little bit of the edge of the lip itself, okay? We're using Juvederm Ultra Plus, going back to the basics. Just want her to get some nice volume there. She's doing really good, actually. Really good. Again, we're just creating a shape here. Okay. Good. You can see on the other half, come around, you guys. You can see one half already having some shaping. We're going to go right into the edge here. You got to create the line, create the shape. Doing great. So again, we want to give her a little lift into the border. And once we start lasering here, once we start using the surfacing, so we're using the volume here, you guys, to really recreate a lot of the loss, but I can't recreate lifting. So this is why I'm trying to get at least the border of her lip to come up. Using both a pillar technique and columns. Good. All right. So now, at least we have a building block upon which we can now improve the folds and fine lines. So let's see. Let's take a look. Looks very natural. So the next step now is going to be a couple things. One is I want to improve some of her fine lines. So I want to work on her nasolabial just a little to get some softening. We're now using a softer filler that goes more superficial called Bellatero. And what this is going to do is, you see these lines here, you guys? We're going to go right into that line, very superficial, and we're going to inject right into that baby line. And that little fine line, I know it doesn't feel the best, and we can do this for all these little baby ones here. It will allow us to plump those superficially until she's ready to do lasers, do more fillers to the lip. You see, we go right into that line. I know it doesn't feel the best, but you're doing great. You're doing so great. And I always tell people little bits. This is the finesse filler. Sometimes it actually pops out. It's so superficial. It's like that. Go right into that. Right. This is a superficial dermal filler. You want it to go right into the line itself. Again, I want to give her a little more. See these lines right here? Little baby. See how it's like squeezes right out? Doing great. Turn this way. So you guys see here these fine lines. If you look at one side versus the other, hold on, good. We can chase all of these little ones through here if we want. But again, texture is also going to improve that area. So don't overdo it. So that's about halfway. We go to the other half. How are you doing? Good. Now I want to, listen, I want to go and do all this, you guys, but I also want to give her the biggest bang for what she's here for. So we're working, we're working on her folds and some of her lines directly around her mouth, because that's what she'll see the most, at least right off the bat. So you see all these lines here. If you look on this side, you see that kind of yellow orange peel texture. That's now improved on that one side. So now we're going to go right into these lines here and start to improve them here. Sometimes you can actually go directly into the line, but the biggest thing here is turn a little bit so you can show, there you go. You can show everybody, we're just going right into these lines. It's not the best feeling, she's doing really, really good. So these here too. And I get questions asked a lot. You can laser the lips, you guys. So, for example, she has some sort of lines and sun damage that go all the way up into the lip there. Towards me. There you go. Right in here, so we can laser those. the whole idea here is we're going to get a nice sort of full at least with volume perioral rejuvenation. Go right into there, see.
Someone said, please thank this lady on our behalf for letting us watch. Very generous.
She is. She's generous and strong, you guys. This is not an easy treatment to do. We're almost there, at least for this short amount, because I like to do only a little bit and then see how well this will take. Perfect. And then how we build from there, because we're gonna laser, we're gonna do other things, but at least in the meantime, she'll have a nice improvement. So we're gonna wipe her off. She really well.
Should we sit her up a bit?
Yeah, I want to sit her up. Come and sit up just a little bit. Let me take a look. Take a look. Yeah, it's much better. Like we said, a building process. But at least now we can see your lip. And in the next couple weeks, when you move your mouth, you're not going to notice the lines so much until we start to laser or microneedle. Here, take a look at this for right now.
Oh my God, look at this.
And I honestly think you can't even really tell yet because the Bellatero takes a couple weeks to really soften. So my focus for you is really just right here.
Mm-hmm.
But eventually when we laser and we do everything, we're going to go, obviously we're going to lift and everything here.
Mm-hmm.
So when we do that and we texture, it's going to be such a big difference. But the key is that we get satisfied patients. We want them to be happy.
What
And we
a
want her to do
difference
the
from when I
long
walked
term.
in the door and had no lips that had receded.
I know, you at least have lips.
Yes, exactly. And it was to the point of, he would be the only person that I would trust
Yeah,
to do
you
this.
really do look like you have lips now.
I do, because I didn't have lips.
She had no lips.
They disappeared.
They look great. All right, now what we need to do is the lip plumper, and then we come back in 15 minutes. So that's what we're gonna do. All right, you guys, thank her so much because it's a lot of pokes, but it's definitely a big improvement.